The Centers for Disease Control and Prevention will no longer recommend COVID-19 vaccines for healthy pregnant women and children. The announcement came Tuesday from Health and Human Services Secretary Robert F. Kennedy Jr. Removing these recommendations mean these patients could have to pay out of pocket to get these shots, and it's at odds with the Food and Drug Administration, saying pregnancy is among the underlying conditions that warrant continued COVID vaccine approval. So far, the CDC has not updated its online immunization schedule to reflect this announcement. CBS News digital reporter Alex Tin joins us now. So, Alex, isn't there a CDC panel that puts out these recommendations, and they've been weighing whether to narrow the recommendations, but this goes further than that.
Yeah, that's right. Look, the usual process is there is an outside panel of experts, doctors, scientists, nurses from the CDC's Advisory Committee on Immunization Practices that is supposed to weigh exactly this question. And they were, in fact, in the middle of the process of doing just that. They had met last in April. There was another meeting scheduled for June, and they were already discussing how and whether to narrow the once universal COVID-19 vaccine recommendations to potentially just older adults and other people who are at risk of severe disease. Now, it's important to note that while it is true that recommendation that they were leaning towards would have omitted healthy children from being eligible to get a COVID-19 vaccine, one difference between what they were backing and what Kennedy's announcement was today is pregnant women. And that's because, as the ACIP, that's the Advisory Committee on Immunization Practices, had been discussing, pregnant women are at increased risk of severe disease. They're still going to the hospital at higher rates. They're still at a greater risk of severe disease. But also, when you vaccinate pregnant women, you often offer protection to their newborns. And we also know newborns are at elevated risk of COVID-19 hospitalization as well.
What pushback is this getting from, for example, the American College of Obstetricians and Gynecologists?
Yeah, I mean, look, when you hear from doctors' groups, including the one you just mentioned, they are frustrated. They're frustrated that the Kennedy appears to be trying to bypass the usual process to essentially debate these recommendations, to explain them, to do it in open, to solicit public comment. That's one end of it. But obviously, what you heard from ACOG is the more specific frustration that this decision doesn't seem to have been made on any science, at least that they're aware of.
What can you tell us about a new COVID variant that has led to a surge in China and has been detected at U.S. airports in California, Washington, Virginia, New York City area?
Yeah, this new variant, it's called NB.1.8.1, is just the latest new COVID variant we've seen come out of Asia in recent months. What's making it different is that it really seems to be driving a significant increase in COVID infections in multiple Asian countries, including China. And as we're seeing now on the screen, has been detected in several U.S. states as well. What we've heard from officials in Asia is that there isn't any evidence right now that this variant is causing more severe disease. There's been a lot of study right now that's come out from some early draft papers from Chinese researchers looking at this virus, that it doesn't seem to be causing that more severe disease. But there is a sign that it does appear to be more transmissible. And it's coming just as we've heard a lot of CDC officials warn us that we are overdue for what is usually a surge of COVID-19 that usually happens twice a year, once in the winter and once in the warmer months right about now.
All right, Alex Tin, thank you.